Hello, and thank you for joining us today to learn more about your transition from your employer's group insurance plan over to individual Medicare. I want to tell you a bit more about Extend Health. Who is Extend Health? Well, first of all, we're an independent company. We're not associated with any insurance company, but we do partner with over 65 different insurance companies in being able to offer their coverage to our retirees around the country. At Extend Health, we really only do one thing, and that is to assist people just like you to make this same transition. All of our benefit advisors are based here in Salt Lake City, and they're very excited and anxious to be able to work with you this fall in helping you find what is the best coverage for you. They are very objective about that, and they will become your trusted advisor as they help you to make this transition. Each of them is focused on only one thing, and that's helping you to make a very informed decision so it can be a very confident decision as you make this important change in your health care coverage. Why did your employer choose Extend Health to help you with this? Well, first of all, we're very experienced. Over the last 5 years, we've helped about 250,000 people to make this same transition. And our services are provided at no cost to you, the eligible retirees, spouses, and surviving spouses. I mentioned that we've worked with many different companies over the last several years in making this transition. There's just a few of them that you'll see there. Names you certainly recognize, such as Ford, Kellogg's, Caterpillar, and Avon. So we do have a great deal of experience, and we know that we'll be able to make this an easy and pleasant experience for you in making the transition. Let's talk for a moment about the different plans that we offer and the insurance companies that we do partner with. We offer all types of Medicare plans, Medicare Advantage plans, Medigap plans, also sometimes known as Medicare supplements, and prescription drug, also known as Part D plans. There's just a sample of a few of the insurance companies that we do partner with around the nation. Names you'll certainly recognize again, such as Blue Cross Blue Shield, Humana, AARP. How does the process work? Well, first of all, it's a process of education. We're going to give you some education, but more importantly, you're going to educate us about your situation and what you need and what you prefer in your health care coverage. After we've educated one another about this, we're going to evaluate what your specific needs are and then move forward with confidence in helping you to enroll in the plan. Then we're not going away after that. We're still going to be here to help you manage your health care coverage. If you have a question, we're only a phone call away. Please do reach out to us. We're here to help you in any way that we can. I talked a bit about education. First of all, this is education for you. Many of you have probably already received the Getting Started guide from Extend Health. If you haven't, that's all right. It may still be coming in the mail, but any of the benefit advisors can give you all of the information that is in here. It does have a handy place for you to gather some information that we will need, such as the prescriptions that you take on an ongoing basis, the doctors that you see regularly. You don't need to write down any pre-existing conditions that you might have because only one would limit your plan choices, and that is end-stage renal disease. Other than that, you are guaranteed issue into any type of Medicare plan that you would like to select. Then we're going to schedule an evaluation and enrollment appointment call. We want to have an appointment so that we make sure that no one is left out. We simply will not leave anyone behind. So do give us a call at the phone number here on this website or that's in any of the communications that you've received from your employer. We will also be reaching out to you in case we haven't heard from you. So if you get a call from one of our benefit advisors here in Salt Lake City at a toll-free number, please do answer that and make them feel welcome because they're calling simply to help you in the best way that they can. A little bit more about education. You're going to get, within a few weeks, a piece called the Enrollment Guide. That will come to you again in the mail. This is going to give you more information to read a little bit about and prepare you for the enrollment discussion call. Reviews the Medicare basics, and it also has a handy place to put a appointment confirmation reminder for yourself so that you'll know when we will be talking with you and possibly a spouse to finish your enrollment up. Okay. When we evaluate and enroll, that's going to be with one of our licensed benefit advisors here in Salt Lake City. Everyone is right here, and they are your objective advocate. Their pay does not depend on what type of plan they enroll you in, so they can be objective. They can be your single point of contact. As you call, you will be routed to the first available benefit advisor that's licensed in your state, but if you would like to continue to work with one specific advisor, you're more than able to do that. Just ask. All of our benefit advisors are very well trained. They go through about 6 weeks of training before they're working with you in the fall, and they're available to you Monday through Friday, 9 a.m. until 9 p.m. Eastern Time. The benefit advisors use some very high-tech, cutting-edge decision support tools. These are available through the website as well. They're called Help Me Choose and Prescription Profiler, where we will enter in information about your particular situation, and then that will assist us to assist you in making decisions about what's the best coverage. The enrollment process then is the benefit advisor can discuss with anyone that you will give us permission to speak with about your coverage. As we get to the final step of enrollment, of actually completing that, we will need to speak to the participant to complete that enrollment, and that is per Medicare regulations and for your protection and privacy. Then once you've made a selection, the enrollment is completed right over the telephone, and 100% of those calls are recorded. That's for your safety and your protection.